Okay. Hello, my name is David Turnberger. I am a paramedic here 2 student, and I am going to be performing my intramuscular and subcutaneous peer review checkoffs as well as my instructor checkoff. So starting off, I am supposed to gather up all of my materials. So I have my gauze pad, I have my lovely nursing girlfriend provided me a inject-a-skin to practice with, and gathered up all my materials. So next what I'll be doing is moving in. Do you want to be my patient? Okay, cool. So do you have any known allergies?
Nope.
No? Cool. So now what I'm going to be doing is going to be giving a intramuscular injection into your deltoid. So next, appropriate syringe and needles, have my sharps container, alcohol swabs, yeah, got all my materials. So next, I'll be having to check my administration of my medications. So go over and inspect my medications. So I have cyanocobalamin, which was provided for me. Check the expiration date, March of 2018. So just a little expired. So I would also go over and check my right patient. So I would ask my patient to tell me their name as well as 2 patient identifiers. So can you tell me your name and date of birth? So, okay, check for the right dosage and concentration. So come on over, I have a 1 milliliter vial. I would go over and double check that with a drug reference guide just to make sure. Make sure that I'm giving this at the right time, as well as that I'm giving this per the right route. So I'll be giving this as an IM injection. Also, I'll be checking to see if I have I'm not in a hospital. I almost said a patient order for it, but I'm in the back of the truck providing it. So anywho, as I'm going to be looking over the medication, I'll be checking the expiration date as well as looking at the medication to see if there's clarity. Next, I will be assembling my needle.
So when you are explaining to the patient what you're doing, you're going to tell them something you said deltoid, right?
More than likely.
Patients have no clue what that is.
Saying I'm giving it in your upper shoulder.
So was I going to say, you're going to stick it in my butt?
So, but it's good to know I didn't think about that. So yeah, giving it in your shoulder. Assembling my needle, reconfirm medication, cyanocobalamin, take to verbalize appropriate PPE. It's kind of weird having to do like 5 attempts of just practicing and then 1 official one. Okay. Identify and cleanses appropriate injection site. Okay. Oh, I was like, where does it say draw the appropriate medication? Alrighty, so got 1 milliliter. I did not clean the top of this. Yeah, that's weird. There's still a little bit of B12 in there.
Why is it pink?
Because B12 is actually pink, and this is mainly composed of a little bit of leftover B12 and water.
Oh, do you put water in there?
Yeah. Alright, then I'm going to get the air out. Go back, re-clean my injection site. For an IM injection, would you pinch the skin or anything, or you just pull the taut? Okay. So since we're doing an IM injection, I'd make sure that I would get all the air out, inspect my needle, then I will be pulling the skin taut. What?
Make sure your bevel is up.
Oh, good to know. Make sure that my bevel is up according to my nursing girlfriend. Stab it in, inform the patient that there will be a little pinch. Slowly inject the medication. Pull it out. And then going to apply direct pressure. Place the bandage on, apply direct pressure, cover the puncture site. And then I'm going to be reusing this, but in all actuality, I would put this in my sharps container, but Since I'm reusing this, I'm going to do the wrong thing of recapping it. Put that off to the side. And then I would apply direct pressure, verbalize the need to observe patient. Cool, so I covered the puncture site. Then I will observe the patient for any type of desired side effects. And then accepts evaluation and criticism. Cool, so that's the end of my skill sheet.
I have one comment.
Yeah.
Tell the patient you're going to poke them before you
Yeah, I
actually
realize
poke
that.
them.
Yeah,
And
yeah.
make sure you go in all the way.
Undesired side effects, not desired side effects.
True.
At least when we give it, you go all the way in until like the syringe is right here.
Ow.
It's not going to go into your muscle if you barely go in.
Still, ow. Okay, setting up. Do this 4 more times. So yeah, I need to clean the top of this, inform the patient, go through it quicker.
Oh, I'm dumb. Sorry, I forgot.
No, I don't care. I'll say right before I do the official one to be kind of quiet. Okay, starting back from the beginning, ask my patient if they have any known allergies. Clearly explains procedure to patient. So, hi, we are going to be giving a intramuscular injection to your deltoid. That just means I'm going to give a little pinch into your shoulder. So I'm going to be, according to this, give cyanocobalamin. Going to check and see the expiration date as well as clarity. So March 2018, just a little expired. Check for the clarity of it. Looks like water. Cool. Then I will be checking my patient rights. So I'll be making sure that this is my right patient. Can you tell me your name and date of birth? Sweet. Rechecking my medication, making sure this is the right thing. Making sure that I have the right dosage or concentration. So I want 1 milliliter, have a 1 milliliter vial. Making sure that I'm giving this at the right time. This would be a right time for the situation, as well as giving this in the right route. This is an IM injection. So doing that. I would go ahead, assemble my needle, get my needle all ready to go, and then I will take alcohol pad, clean the top, uncap my needle, take 1 milliliter of air, inject it, what?
Have you done the one you did nothing?
What, that?
No.
Oh, you don't like my style?
I'm pretty sure you're supposed to hold on to it the entire time.
Oh, yeah. Alrighty, aspirate all the air out. Okay, set that aside. Go over, clean the injection site, explain to your patient one more time, hey, you're going to be feeling a little pinch. You said for an IM injection, I need to go like all the way down?
Majority of the way.
Ow. Okay, ready? 1, 2, 3.
Ouch!
Wow, there's side effects. Or did I say side effects? Sound effects. Okay. Apply direct pressure. Hold down your package. Hold down your dressing. Apply direct pressure, and then evaluate your patient for any undesired side effects. What? Yes, I can't speak.
No, did you drink that before or after you stuck the needle in there?
I'm using this water.
Oh.
Not my own water. That'd be weird. Well, so I have
injection water for
I have 1 cup that I've been using to refill the vial, and then I have another one to drink, and she thinks that I was,
I thought you did.
yeah.
Okay, so it's just the last.
Can I show you what I was talking about with that really quick?
Sure.
Sorry, I know you're. So like, say you're gonna get what? No. Yeah. Inject it,
Mm-hmm.
and then you flip it over, hold it with 2 fingers. This is how you hold it. Actually, wait, no, it's not. Yeah, that's it might help if I'm actually pulling from fluid and not.
And then I'll steal that back from you whenever you're done with it.
Yeah, that's what I was needing. Like,
Cool.
you know, just go.
Okay, I'll steal that. You just want to put that back in the green cup. Just put that back in the green cup. Thank you. Okay. See it again. Gather all my materials. Ask my patient if they have any known allergies. Do you have any known allergies? No? Cool. Explain the procedure to my patient. So I will inform them we are going to be giving an intramuscular injection into your deltoid. That means that I'm going to be going in at a 90-degree angle. Going to be giving it at a 90-degree angle. Pretty much that means I'm going to be giving a little poke into your shoulder. So can you tell me your name and your date of birth? Okay, cool. So I got my 2 patient identifiers. Next, I'm going to look at my medication, see if I have the right dosage. So I have a 1 milliliter dosage of cyanocobalamin. I will look at it, seconds for clarity as well as expiration, making sure that this is the right medication that I'm wanting. So cyanocobalamin. I believe that's my fact right. So I got my right patient. Oh, and then make sure that I'm giving this at the right time. So next what I will do is I will clean the top of my vial, then I'll uncap my needle, pull back 1 milliliter of air, inject it, flip it over, 1 milliliter of air, get all the air out, set that aside, check my medication again, sign up for cyanocobalamin. Yet again, re-inform to my patient, talk to them one more time, say, hey, you're going to be feeling a little pinch, clean my injection site. Okay, pull the top, 1, 2, 3. Inject it slowly. Pull it out, apply direct pressure, take your pad, hold it down, apply direct pressure. Then you will wait and evaluate your patient for any undesired side effects, place this in the sharps container, and then document. I believe that was my 3rd try. Do this 2 more times. Okay. Make sure that I'm doing everything right. Okay, so allergies, gather all your equipment, sharps container, alcohol swab, right medication, multiple laws, and all syringe needle. Okay, cool. So for this scenario, I'll say that I'm also giving it as a subcutaneous injection. So yet again, start off with your patient, asking them if they have any known allergies. So if you have any known allergies, no, great. So what I'm going to be doing is I'm going to be giving what is known as a subcutaneous injection. I'm going to be giving it at a 45-degree angle into your abdomen. Pretty much what that means is I'm going to grab a little bit of the fat on your stomach, give a little pinch, and inject the medication. So following with that, I'll ask them for 2 patient identifiers. So can you tell me your name and your date of birth? Next, I will go over and look at my medication, cyanocobalamin, great. If I have the right dose, so 1 milliliter vial, that's what I'm looking for. Make sure that I'm giving this in the right route, so going to be giving this as a subcutaneous route for IM or subcutaneous injection, great. Next, I'll also be checking the expiration date as well as clarity. And then also going to be making sure that I'm giving this at the right time and the right desired time that it's needed. Next, I will go and I will set up all of my equipment. So I will undo my paper, get my bandage all set up, unwrap everything, and inspect my medication one more time. Talk to my patient, I'll let them know what I'm doing. Apply appropriate PPE, get 1 milliliter of air. Get all the air out. Okay. Then I will go over, I will clean the injection site. Then since I'm giving this sub-Q, I'm going to pinch, go in at a 45-degree angle. Going to slowly give my injection. And then pull it out, apply direct pressure, apply my bandage. And then yet again evaluate and watch over my patient for any undesired side effects. Woohoo! Yay, one more time.
You want to show them you have a landmark?
Yeah, I will in the final one. Okay, cool. Just one more time for practice. Okay, cool. Alright, so gather up all my materials, ask my patient if they have any known allergies, explain what I'm going to be doing. Okay, I'm going to be giving a subcutaneous injection into your abdomen. That means that I'm going to be going at a 45-degree angle, going to be pinching a little bit of the fat on your abdomen, and then I'm going to be injecting the medication like so. So starting off, I'm going to inspect my medication. So I have cyanocobalamin, which is what I'm wanting to provide. Make sure that I can give it at the right route. IM or subcutaneous, so this will work. Have the right dosage, 1 milliliter, which is what I want to give for a 1 milliliter vial. I will yet again ask my patient for 2 patient identifiers, such as their name and date of birth. And then inspect my medication for clarity and the expiration date. And then I'm also going to make sure that this is the right time that I need to be giving it to my patient. Next, I will set up my needle, get my needle all ready to go. And then I will put on PPE, go over, take my alcohol pad, clean the top of the vial, take my needle, 1 milliliter of air. Okay, get rid of all the air. Check my medication one more time. Cyanocobalamin, perfect. Set that aside. Go over to my patient, clean the area, talk to them again. Then I'm going to say, alrighty, you're going to feel a little pinch. I'll pinch their abdomen. Go one, make sure my bevel is up. 1, 2, 3, big stick. Slowly inject the medication. Okay. Pull it out. Apply pressure. Take my pad. Hold it down. Check for any undesired side effects. And evaluate them and see if there's anything out of the ordinary that is happening. Alrighty, time to set up for the official one. Yay! I mean, you don't have to.
Yeah, you know why? You make sure IM injections are allowed.
So you don't.
There's actually quite a few IM injections that will destroy subcutaneous skin. Like subcutaneous fat. So if you give it a subcutaneous fat, it won't absorb and it's going to destroy that skin. That's why you make sure it goes all the way in.
Okay, got that. Evaluate the sheet one more time. Pinches skin. Administers correct dose. Remove needle.
You can't really hear it.
Aspirate syringe while observing for blood return. Oh, I've been forgetting to say I've been checking for blood return. I've been doing that in my head, just haven't been saying that out loud. But I'll do that for the official one. Administers correct dose, proper push rate. Okay. Alright, set that aside. Okay, that. Pretend like that's all good. Get that. Okay, cool. You want to be my patient? You want to be in the video? Cool. Let's do it right there. Or you can pull up a chair and come over here. This is my.
My shorts look purple on your camera.
Yeah.
So
Okay, here's somewhat of my official attempt. Okay,
you can't hear it though. Can you hear it?
it's all good.
No, you don't need that.
Alright, so coming over. Alright, so today what we're going to be doing is I'm going to be giving a IM injection into your deltoid. So that means that I'm going to be putting going to be going in at a 90 degree angle. You're going to feel a little pinch, and then I'm going to administer the medication. Is that all right? Okay. Do you have any known allergies? No? All right. Can you tell me your name and date of birth?
Molly 12/08/99.
Okay. Well, I'm going to be administering what is known as cyanocobalamin. So I'm checking my medication. I am also going to be checking the dose. So a 1 milliliter vial, which is what this vial has. I'm going to make sure that I can give it at the right route. So it says for IM or subcutaneous use only. So that's what I'm going to be measuring at. Or sorry, that's confirming that I can give it at the right route. I'm also going to make sure that I'm giving this at the right time. Okay. So next I'm going to make sure that I have all of my materials gathered, and then I'm also going to check over my vial, look at the clarity of the medication as well as the expiration date. Okay, then I'm going to gather up all my materials. So I'll start off by setting up my needle. What?
Is that like the normal hospital ones?
Kind of weird. Set my trash aside. The next I will take and establish appropriate PPE. Alright, then I will check my medication one more time, cyanocobalamin, good. Clean my injection, or my vial. Uncap my needle. Pull back 1 milliliter of air. Inject it into my vial. You look so entertained. Huh?
Hold on to your vial.
What, make you nervous? Alright, make sure that I have aspirated all the air out, set that aside, and then, so kind of using her as an example, I'm actually not going to stab her because she would probably kill me. I would go over to the injection site, I would clean it, re-explain my procedure, be like, alright, yet again, this is where I'm going to be giving my injection. So what I will do is then I'll pull the skin taut, and then I would give my injection about there. Oh, I'm not seeing my dog yet. Oh, okay, very briefly. But I would get my injection there. I would go in at a 90-degree angle, and then once I injected it, I would, well here, I'll just demonstrate on here. So say this is her skin, I'd clean the area, and then I will make sure that my bevel is up, pull the skin taut, and then I'll say, alrighty, you're going to feel a little pinch, 1, 2, 3, inject it. Then I'm going to see if there's any blood return. Don't see that there's any blood return. Then I'm going to slowly push the medication. And then once I pull that out, I will apply direct pressure, put this directly in the sharps container, take my bandage, cover it up, apply direct pressure, make sure that the bleeding is stopped, and then I will evaluate my patient to see if there's any more undesired side effects, and then I will take off my PPE, document my procedures, and move on.